first 2 years of my training in surgical residency, my day looked like this. Going to the blood bank, waiting, coming back, running back with the blood to the operation theatre or to the wards, writing discharges at 2 a.m. for patients whom I'd never see again, seeing seniors do procedures while I held the retractor for hours. Same corridor, same ward, same task every single day. I was miserable. I kept asking, why is this so boring? Until one day, something changed. It was my 47th trip to the blood bank that week. 48th, I lost count. I was waiting for my turn, angry, frustrated, and was thinking, I didn't give up 10 years of my life to be a glorified transport system. And then I looked up. On the walls of the blood bank, there were these old photographs of scientists and researchers, names I'd never paid attention to. Dusty, faded, almost hidden photographs. Carl Landsteiner, Charles Drew, Jenny Davison Vaughan. And below each photograph, there was one paragraph biography. I had 15 minutes to wait anyway, so I read one. Carl Landsteiner discovered blood group in 1901. But here's what got me. He was a pathologist who was trying to understand why certain blood transfusions killed people and certain saved lives. He didn't set out to discover blood groups. He was chasing mystery. And suddenly, the blood bag in my hand wasn't a routine task anymore. It was one man's obsession, the end result of one man's obsession. A century of human curiosity. It was Carl Landsteiner's sleepless nights, Charles Drew's innovation, and the reason why my patient in bed number 6 was going to make it through the night. Then, I started looking forward to going to the blood bank. That's when I realized the problem wasn't the task. The problem was my relationship with the task. And that day I stumbled upon something which now I call as the curiosity code, and which is this. Anything, and I mean anything, can become interesting if you learn to ask the right questions about it. Not philosophical ones, not existential ones. Simple, curious, childlike questions. And I want to show you how this is like, starting with a name you already know. Ignaz Semmelweis. Yes, he's in your microbiology textbook. The man who discovered hand washing. But here's what the textbook skips. In 1847, Semmelweis was working in the maternity wards of Vienna General Hospital. 2 wards side by side. But the maternal mortality rate in Ward 1 was 10 to 35%. In Ward 2, it was under 2%. All other doctors who looked at those numbers moved on. Semmelweis couldn't. It haunted him. He was obsessed because he refused to accept that this was just the way it was. And he figured out. Ward 1 was staffed by doctors who came straight out of autopsies, and Ward 2 by midwives. So there was no hand washing between the patient and the corpse. He introduced chlorinated lime hand washing. The maternal mortality dropped from 35 to 2% within months. But here's the tough part. The medical fraternity back then destroyed him. They dismissed his data, ridiculed him. He died at the age of 47 in an asylum, having never seen his discovery being accepted in his lifetime. You would have washed your hands 1,000 times in med school. Have you ever thought about this man who died just because you would know how to do that? Okay, think about pharmacology, our least favorite subject. Beta blockers. You would have memorized they act on beta adrenergic receptors, decreases heart rate used in hypertension, and then you move on to the next important question. But have you ever wondered why were they discovered in the first place? In 1964, a pharmacologist, James Black, was watching patients die of heart attacks. And he couldn't stop thinking that the heart, when in stress, rushes itself with adrenaline, which pushes the heart, ruptures it. What if we shield the heart of its own panic response? He asked. He didn't set out to do a blockbuster discovery. He was just trying to answer a question that didn't leave him alone. Beta blockers won him the Nobel Prize. And today, it's in the pocket of 1 in every 5 cardiac patients in India. And this is not just about the drugs. Alexander Fleming almost didn't publish his discovery of penicillin because for some time he thought that the contaminated Petri dish was a failed experiment, not a revolution. So what changed across all of these? The circumstance didn't. The questions did. Now here's where it gets a little weird. I started playing this game with myself when I was in my surgical residency. Whenever I used to walk from my surgical ward to the canteen, probably 10 times a day, I used to guess how many steps to the canteen. 137. Then I'd walk and count. From the canteen to the library, I'd guess 84 steps, and then I'd walk and count. From the library to the hostel, I'd say 104 steps. My colleagues thought I had lost it. They asked, "Why are you counting steps?" And I said, "See, I'm going to walk this corridors 100 million times in residency. I might as well make it interesting." But here's what happens when you count steps. You cannot simultaneously be resentful about having to walk. You cannot be cribbing and complaining about your work. You cannot allow your last night's mistake to play as a loop in your head. That's when I realized boredom isn't the task. Boredom is mental vacancy. And that happens when your mind has nothing to hold on to. So it defaults to cribbing, complaining, catastrophizing, or comparing itself with others. Give your mind a question, a simple, even a ridiculous one, and see how the loop stops. So suppose you're in a routine, repetitive ward work. Ask yourself, what is that one thing about this patient which no one else has observed? Suppose you're in a lecture which is not going anywhere. Pick a concept, trace it back to history, ask who described it first. What problem were they trying to solve? Same task, but a different relationship and a different mental state altogether. So here's what I have learned. The world is not divided into boring and interesting things. It is divided into things that you have asked questions about and things you haven't. Every disease has a story. Every drug has an origin. Every clinical guideline was written in response to a tragedy that someone decided should not ever happen again. The stethoscope was invented by René Laennec in 1816 just because he was embarrassed to put his ear to the patient's chest. Embarrassment drew medicine's most beautiful innovation. The surgical glove. William Halsted didn't invent it because he wanted to prevent infection. His scrub nurse, whom he liked, had a skin allergy to the carbolic acid that they used. So he custom-made rubber gloves for her. Infection rates dropped and gloves became a standard worldwide. The role of aspirin in heart attacks was discovered by a general practitioner, Lawrence Craven, in 1947. Because he noticed that his tonsillectomy patients who chewed aspergum didn't clot as well. He wasn't a cardiologist. He was just paying attention. Nothing in life is boring. You just haven't looked close enough yet. And here's something which no one will ever tell you. The thing that you do to boring, familiar tasks, you tend to do the same things to people around you. Because people become familiar with time. And familiarity is the enemy of curiosity. The more familiar someone becomes to you, your friend, colleague, patient, someone you love, the less curious you start becoming about him. And curiosity is what keeps every relationship alive. So I want to end this on something which is not related to medicine at all. I want to talk to you about your life. Not your degree, not your career, your life today, at present. So please be honest and tell me, how often are you exactly at a place where you want to be? Or with someone whom you want to be with? Or doing something that you always wanted to do? Almost never. Most of you are in a city that's not home. In a posting that you didn't choose. In a situation that you're just trying to survive. Sitting beside someone you didn't pick. Doing work that you feel is just like not enough. And when that happens, most of you, in those moments, wait. You wait for the situation to become interesting, for the work to become meaningful, for people around you to start becoming worth knowing. Thus, you outsource your curiosity to your circumstances, and your circumstance almost always disappoints you. You are going to spend years, rather decades, in situations you won't choose. That's not just a complaint. That's life. So what I learned in that blood bank, what Semmelweis already knew while he was standing between those two wards, what James Black knew while he was watching those hearts fail, is this: that your attention, where you point it, what questions you ask out of it, is the thing that determines your experience of life. What I want you to carry out of this room today is this: you are never as stuck as you feel you are. Because the moment you become curious about your situation, about the person, about the thing that is in front of you, you have shifted something. Not the circumstance. You have shifted. Because when you change the question, you change the whole experience every single time. Most of your happiness or your misery doesn't come from the situation you are in. It comes from the questions you decide to ask about the situation. You become a sum of what you paid attention to, not what happened to you, not where life placed you, not who was around you, but what you chose to be curious about. That corridor in blood bank didn't change. I asked a different question, and I became a different person walking through it. That's the curiosity code. Thank you.